Good morning, everyone. Welcome. I guess you can all hear me. Welcome to the conference Advancing Healthcare Inclusion and Equal Treatment for People with Intellectual Disabilities. My name is Roberto Zanon. I'm the head of projects at the European Platform for Rehabilitation. I'm going to be your host for today, so I'm going to guide you through the event. First of all, just some housekeeping rules for those of you that are here and those of you that are joining us online. For those of you that are here, the Wi-Fi is available, so you can just, actually there are 3 Wi-Fis available, so we are in very safe hands. You don't need to put any code or anything, you just log in. For those of you that are online, for the moment, we ask you to stay to remain muted, of course. We will have the chance during the Q&A to listen to your questions in case you have questions, or you can use the chat whenever you want to drop your questions, and we are going to read them out loud, or depending on the time we have, we may ask you to share your questions with us. The meeting is going to be recorded for dissemination purposes, so if you're online, if you prefer not to be seen, just shout down your cam, and of course anonymize your profiles or your name. And for those of you in the room, you will be actually on the focus only if you speak, as is happening for me at the moment. So without further ado, I would just like to welcome the person that is actually welcoming us here for the 3rd time, I guess, in the last year. So we are established a very good collaboration. We are hosted by the European Economic and Social Committee, and I would like to welcome Christophe Lefebvre, the President of the Permanent Study Group on Disability Rights of the European Economic and Social Committee. So welcome, and thank you for having us here again.
Thank you. Okay, thank you. So thank you for first. Thank you to be here for us. This is very important to have this partnership with such an organization. We are the bridge between the civil society and the European institution. Of course, by ourselves we produce opinions that goes to for my part to the European Parliament for the legislative way of trying to make Europe better, and also every time you have a country that takes the presidency of the European of the Council, we have almost at least one opinion that is requested by this country to make things better towards disability rights. Just to tell a few words, and then after I will give back the floor. We have a group of 12 people that are in charge to check if everything is okay regarding the respect of the United Nations Convention of the Rights of Persons with Disabilities. So we make 3 or 4 fact-finding missions inside Europe every year. We try to get back good practices, and also we check if there's bad practices made in countries. And of course, we have a coordination with the European Commission and with the group, the intergroup of a member of the European Parliament in charge of disability, and we all met in once a year there is a week in New York in the United Nations where we check. I mean, we make a kind of confrontation between what is done among the 183 countries that are members of the United Nations. And this year, this was just to focus on this. This was the first time that you have a board of directors inside the CRPD convention, and this is the first time that we success in making the nomination of one European representative in this board. Usually it's just representative of countries. So this is a very good sign, either for the disability thema, and also for Europe as a model. I mean, at least as an organization that tries to make things better. Well, I can just to tell you about the four topics, I mean the three main topics that we focused this year, and I will give back the floor. We had artificial intelligence and how it can impact positively or negatively the lives of people with disabilities, sexual health and reproductive rights for women with disabilities, and disability inclusive disaster risk reduction response regarding the situation that we can see in Ukraine or everywhere else. I will stop right now, and congratulations for all the work that is done by your organization, and I wish you a very interesting interaction today. Thank you very much.
Thank you, Mr. Lefebvre, and again, thanks for the collaboration. It's always, well, you make things easy in terms of European Economic and Social Committee. The collaboration is always very smooth, and everything is very, very precious for us in a way. Without further ado, I would like to start with, well, maybe a brief introduction. I guess you all already know why we are here, but we're going to discuss healthcare inclusion for people with intellectual disabilities. We're going to hear from healthcare professionals, policymakers, academics, and individuals with lived experience to explore this challenge and the opportunities that are linked to that. So we're going to start actually with the first speaker, speaking about his own personal experience. We have Soufiane El Amrani, a member of the European Platform of Self-Advocates and also accessibility expert at Inclusion Europe. Welcome, and the floor is yours.
I went to the hospital because I was not feeling well. My throat was swollen. The doctor said I had mononucleosis, or as they call it in French, la maladie de la belle, which is much more understandable. When I went to see the doctor, he didn't speak to me. He spoke to my parents, and it felt like they were the ones who were sick and not me. And they spoke in French with hard words, which made things even harder for me to follow. This made me very upset. Afterwards, I asked the doctor to explain what was happening in a way I could understand it. It wasn't easy, but we tried together. Finally, I understood what I had. This was just my story of going to the hospital for la maladie de base. But many people with intellectual disability have to make important health decisions. This is even more true for women who may have to decide if they want to have or keep a baby, to have a family, just like everyone else. Today, I would like us to think about three following points. First point, people with intellectual disabilities should have the right to make decisions when it comes to their own bodies, so doctors should speak directly to us and not just to our support person. 2, we need to be able to make informed decisions about our health and understand what the doctor is telling us, and doctors and nurses should find ways to communicate with us clearly so we can understand and make our own decisions. They need to understand when we say something hurts, and we should understand the treatments we are getting. And 3, in general, information on healthcare is not accessible. There are not enough websites on healthcare that are easy to read and understand. This makes it hard for us to make appointments, understand how to get to the hospital, and more. There are many challenges in healthcare for people with intellectual disability, but I hope we can think of ways to ensure we are not treated like idiots. Thank you.
Thank you. Thanks a lot for sharing your experience. And actually, well, we'll have the time to discuss about it later. But in a way, what you were saying is very much in line with the reasons why we implemented the Equal Treatment Project that we're going to discuss later on today. Especially when you were saying, well, I want doctors, nurses, or frontline staff or whatever to talk to me and explain to me things, not to just to others. So this is one of the things we're trying to tackle with the project. So it's very, very important that you were saying that now. So thanks for that. We now have a short video, a very interesting video. It took a long process to be able to put the content of this video in just around 10 minutes. It's a very interesting video from I think I was muted. Now you can hear me, right? Okay. From Dike Sekelariu, Professor of Disability Studies and Occupational Therapy at the Cardiff University and Technical Specialist on Disability Inclusion at the WHO Regional Office of Europe. We shared with him and with the office the policy recommendations developed by the Equal Treatment Project that we're going to, summarize in a way for you later. And again, there are a new interesting collaboration started, and in line with what we're doing with the project, WHO is also going to, DK is going to introduce us to the WHO European Framework for Action to achieve the highest attainable standard of health for persons with disabilities in the time frame 2022-2030. So this is what the video is all about, and it's a shame, of course, that we don't have Mr. Sekelariu here with us, but we appreciate the effort of squeezing everything that he wanted to share with us in around 10 minutes. So I invite you to follow the video.
Good morning, Regional Office for Europe. And today I'm very happy to be able to share with you the work we have been doing at the WHO Regional Office for Europe on disability inclusion for persons across the region. And more specifically, I will be sharing with you the work we have been doing on the WHO European Framework for Action to achieve the highest attainable standard of health for persons with disabilities 2022 to 2030, excuse me. We know that Article 25 of the Convention on the Rights of Persons with Disabilities stipulates that all state parties recognize that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disabilities, and that state parties shall take all appropriate measures to ensure access for persons with disabilities to health services. Access to healthcare is recognized as a human right, as a fundamental human right that everybody should have access to. We're talking about the right to respectful, appropriate, and good quality healthcare delivered in a timely fashion. We know that access to healthcare is associated with better health and better well-being, and also that lack of access to healthcare, to good quality healthcare delivered in a timely fashion, can lead to health problems, higher costs for health systems, and also worse health outcomes for individuals and for populations. In December 2022, the World Health Organization published the Global Report on Health Equity for Persons with Disabilities with the explicit intention to make health equity for persons with disabilities a global health priority, to include that in health strategies and policy making across the world, and ensure that disability and disability inclusion considerations are a central element of health systems. And to do this, multi-sectoral policy and action is needed across the whole spectrum of services and policies. And that includes also empowering people and communities, and of course, the design and the development of integrated health services with an emphasis on primary care and on essential public health functions. And combined, those three elements, multi-sectoral policy and action, empowering people and communities, and integrating health services with an emphasis on primary care, can lead to the strengthening of health systems so they can better respond to the needs of persons with disabilities. In the World Health Organization European region, we know that about 135 million persons with disabilities live, who have the right to the full participation and equitable access to quality health services across what is a very diverse region, including 53 member states. And for this vision, for this right to be realized, we first need to remove barriers to healthcare services. And these barriers can refer to attitudinal, physical, communication, geographical, policy, financial barriers, or other types of barriers, so that we can have an inclusive health sector where good quality, timely, and affordable general, but also specialist health services in primary, secondary, and tertiary care are delivered. And of course, to achieve this, it is very important to eliminate disability discrimination across all parts of health systems, including policies, attitudes, and systems that directly or even indirectly disadvantage persons with disabilities. In September 2022, the 53 member states of the WHO European region adopted the resolution on the WHO European Framework for Action to achieve the highest attainable standard of health for persons with disabilities 2022 to 2030. And the vision of this important framework developed by member states across the region is that by 2030, we will have achieved full inclusions in healthcare planning, delivery, and leadership of persons with disabilities across the WHO European region. This framework is based on human rights, universal design, life course, and health systems approach, and it is equity-based, people-focused, and data-enabled. And it encompasses 4 overarching objectives. The first one is related to universal health coverage and states that all persons with disabilities receive quality health services on an equal basis with others. Objective number 2 stipulates or relates to the promotion of the health and well-being of persons with disabilities through disability-inclusive campaigns, policies, strategies. The third objective states that all health policies and programming, as well as resilience building and recovery plans during public health emergencies, should be disability inclusive. And the fourth objective states the need to build an evidence base on disability and health so that we can know what the current situation is and we can monitor progress towards achieving disability inclusion in our health systems across the region. The framework includes 13 targets and 20 indicators that can act as measures of progress and drivers for policy action. Through using the QR code that you can see on this slide, you can have direct access to the full document of the framework that includes an implementation plan and a monitoring and evaluation plan, and you can find both in the annexes of the document. As part of the implementation plan, the WHO proposes, in collaboration with member states, several actions. Here on this slide, you can see a couple of examples of those actions. The first one relates to supporting and strengthening the availability and affordability of appropriate, safe, effective, and high-quality mental health services for persons with disabilities by increasing funding and investment in mental health care and retaining appropriately trained health personnel. The second proposed action that I have here as an example relates to the introduction, development, and promotion of disability and inclusive well-being activities related to physical and to mental health. And the last proposed action, given as an example here, relates to the removal of barriers to service delivery, including impediments to physical access, information, and communication, and also coordination across all healthcare programs, including those on sexual and reproductive health, on mental health, health promotion, and other population-based public health initiatives. In order to successfully implement this framework, it is important to recognize health inequities. We need to know what the current situation is. We need to know what the state of affairs are, what the problems are, what are the barriers. It is indispensable to include persons with disabilities in all processes and all decision making, and of course, to act in partnership with persons with disabilities and the representative organizations. Only then we can talk about the successful implementation of the framework. The European Programme of Work, which is which stipulates the guiding principles and the general direction of the WHO Regional Office for Europe work for the period of 2022 to 2025, stipulates explicitly that we need to leave no one behind in our efforts to achieve better health across the region. The establishment of a disability-inclusive health sector relies on the strengthening of health systems so that we can realize this promise of member states to leave no one behind. Ultimately, it is about protecting the human rights of persons with disabilities and the promotion of their health and of their well-being. Thank you very much for your attention. If you require more information, please do contact the Disability Inclusion Team at the World Health Organization Regional Office for Europe using the email address you can see on this slide. I would be very happy to discuss with you and to share information about the work we have been doing. Thank you very much, and I hope you have a very successful and productive policy dialogue. Thank you.
And of course, we'd like to thank back Ikea Sakalario for introducing us to the framework, for working with us along the way in a way with the project and touching base on what we're developing. As you heard, I mean, of course, first of all, you will have the video in the documents that we will share after this event, so you can, of course, watch it again, and you're going to have access to the slides and the QR code in case you want to have access to the document directly. Of course, we invite you to have an in-depth look at it. And again, it's very much in line what Mr. Sakalario was saying is very much in line with what we're trying to do as European Platform for Rehabilitation, and of course the consortium that was working with us is working with us actually still for a few days on the Equal Treatment Project. So the key word was barriers, and they were mentioned at the beginning again. So barriers to inclusive health, policy barriers, physical barriers, cultural barriers, communication barriers, or attitudes that need to change. We try to tackle, of course, that through the project. So we are happy that we are very much in line with what WHO is also promoting in a way, and we hope, of course, that collaboration can continue. I'm just checking the time. Okay, I think we're in time. On time. We can move to the first panel discussion, so you will also have the chance to, ask questions and reply to questions, actually. We're going to have 3 speakers that are already here with us. We're going to have, actually, to start from the presentation of Serios Charitakis. Welcome. Researcher at ICF, and you're going to talk to us about the study on guidance to increase access to healthcare for people with disabilities. That is research commissioned by DG Sante. So welcome, of course. And I'm also going to introduce briefly the other 2 speakers for this panel. Laura Vergès, I said it right this time, Vergès Flanaguma. I'm very happy to see you here in person, Laura. We know each other because we were working together on the Equal Treatment Project. You're a psychiatrist at the Mental Health Service for People with Intellectual Disabilities at Instituto de Assistenza Sanitaria in Girona. So welcome. Thank you for joining us in person. And Freddy Jussian, you're advocacy lead of Inclusion Europe, and we collaborated with Inclusion Europe in terms of you were part of the advisory board for the policy recommendations that we developed through the project. So happy to see you here. Thank you for joining us. But first of all, I will leave it to you to discuss the study.
Thank you for the European Platform of Rehabilitation for the invitation. Thank you for the committee for hosting us, and thank you all for coming. Good. So a year ago, we started a study funded by the European Commission, HADEA, and DigiSante, basically on access to healthcare for persons with disabilities, in collaboration with the European Disability Forum and the London School of Hygiene and Tropical Medicine. This is a study that was part of the European Disability Strategy. It is a bit connected also with the WHO, and we also actually collaborated with Vicky Seculariou. He's part of our study team, so there's a lot of interconnection with that study. The study basically aims to analyze barriers to healthcare and bottlenecks for persons with disabilities. It also has a separate section on barriers for access to healthcare for cancer surveys, and I think I'll speak a bit at the end about this, at the end of the panel discussion. And then all this kind of information will inform these guidelines on how to increase access to healthcare for persons with disabilities. So for now, I'll present the results of the first part of the study on the mapping of barriers. The study included EU member states, but also Iceland and Norway. I cannot present all the findings. We don't have enough time, but I'll present the main findings that we think are fundamental for kind of a general contextual discussion. First of all, there is the aspect of barriers that come as a result of policy. And the study identified that first, there is not enough data collection on disability. The data that are collected are not used by member states to inform policy. There is no particular disaggregation based on disability. And overall, there seems to be a lack of expertise on data collection. There is some progress on combating discrimination in the area of healthcare. Member states have adopted legislation to combat discrimination in the field of healthcare and to provide accommodations, but not all the member states. I think it's also important to note here that the European Union has a proposal that can expand the protection to cover against discrimination, to cover healthcare and provide accommodations in that context, but this has not been adopted yet. In terms of financing, inclusive financing, there are very few countries that actually have budget lines on accessibility adjustments or reasonable accommodations, which is highly problematic. And many countries do not have budget lines on rehabilitation and assistive devices. So there is something significantly missing there. And lastly, there are very few countries that have designated a focal point in the Ministry of Health to collaborate and coordinate policies on persons with disabilities. But there have been some efforts in, let's say, establishing coordinating mechanisms that include and consult with persons with disabilities in many member states. Still not perfect, but there is some kind of improvement. In terms of the cost of healthcare and affordability, well, unsurprisingly, we have identified that persons with disabilities face a greater risk of poverty, and there are several reasons for that. One important challenge has to do with the effectiveness of the social protection systems. Many times these systems are inadequate to provide the necessary support, but also persons with disabilities face high eligibility criteria to have access to these benefits, and also the procedure to have access to these benefits is quite challenging. Apart from that, there's also the out-of-pocket costs of healthcare that are estimated around 14.5% in the EU. Particularly problematic is the area of rehabilitation services and assistive devices, again, because a lot of insurances do not provide coverage. And of course, there are overall high costs, bureaucratic hurdles, long waiting times for access to this kind of benefits that create significant challenges for persons with disabilities. We have interviewed a lot of persons with disabilities, like around 90, I think, from all the member states. And we have some important quotes. In this context, there's a female interviewee with an intellectual disability that stated, "I'm regularly afraid that my personal budget will be lowered. I really can't have less, otherwise I won't get the care I need," which shows the real effect of budget cuts on healthcare and the difficulties of accessing social benefits and the impact that they have to persons with disabilities. Moving to accessibility, I think accessibility overall is the area where more progress has been made, particularly on the policy level, and in the areas of physical environment and transport. There has been significant progress in establishing standards on accessibility at policy level. To a certain extent, the digital environment, websites, public websites particularly, but also private websites have improved their accessibility. And I think the area where most work needs to be done is the area of providing information in accessible formats for persons with disabilities in the field of healthcare. The major challenge in that regard in the field of accessibility is the fact that all these standards exist in the law, but they are not particularly monitored. Many states do not do audits. There are no benchmarks in most member states. They just adopt these standards. So this has a significant effect in the implementation of these standards in practice. In terms of barriers with regard to accessibility, there is insufficient information on assistive products and devices. There are communication issues between healthcare professionals and persons with disabilities. And there's a lack of guidance to navigate the healthcare systems. Such systems are very difficult to navigate for persons that do not face disability barriers. I cannot imagine how it will be to have that on top of all the other issues. There are still architectural barriers and structural barriers in the physical environment and the healthcare facilities, particularly with medical devices and machinery. That's why there's this kind of inaccessibility is particularly prevalent for cancer patients, patients in rural areas, and persons with cognitive or intellectual disabilities. And in terms of digital content, basically, the inaccessibilities have a particular impact on persons with visual and cognitive impairments. And this is worsened by basically poor internet connectivity and low digital literacy. In terms of testimonials, there is a lot of uncertainty in the system. The location of the building is incomprehensible. It is very difficult to understand their system. And the first time you find the office, the specialist is already very angry with you being late. So there is also this results to kind of like worsening the interpersonal effects that are very essential between patient and healthcare professional. In terms of informed consent, some countries have made the transition from substitute decision-making to supportive decision-making, but there are still challenges, particularly for individuals with psychosocial and intellectual disabilities, as well as lifelong or congenital disabilities. In terms of barriers, there are serious consent violations, particularly forced treatment, involuntary hospitalization, restraint for treatment and non-compliance, and administering medication without knowledge. And there's still cases that we have identified of forced sterilization amongst EU countries. Of course, additionally, we'll talk about it. There's a lack of training of doctors and nurses, and hopefully the project can contribute to that. Well, to address that, not to contribute to the problem.
Yeah.
Right? A person with psychosocial disabilities from Luxembourg said, I was not informed that the medication I'm taking makes a healthy pregnancy impossible. I found this out after starting to take the medication. And all these kind of barriers are indicative of not just, let's say, informed consent, but also the accessibility of information, the issues with the communication of the doctors and their ability to communicate information appropriately, but also prejudice and stereotypes about women with disabilities and sexuality and disability. In terms of availability of healthcare services, overall, most of the member states and the countries that we mapped provide universal coverage for essential services, but there are still challenges. Well, there's a significant shortage of healthcare workers, and there's a high demand for healthcare that creates quite a challenge and long waiting lines and bad services, really. This is particularly significant in rural areas and regions with experiencing brain drain, where basically there are not enough healthcare professionals. And after the pandemic and during the pandemic had a significant effect on access to healthcare, particularly for mental health services. So the demand for mental health services increased, and mental health is an area where there's a significant shortage already before the pandemic of professionals. Also, rehabilitation services face a shortage of workforce. And overall, the effect of the pandemic had to do with also like suspending not urgent treatments, which kind of like rehabilitation services and mental health that basically had a significant impact, particularly for persons with disabilities. And lastly, the topic of your project. Overall, we found that few member states provide disability-related training to healthcare professionals. And in these kind of trainings, also persons with disabilities were not involved in the development of the training. So there was also this kind of aspect that was lacking. In terms of barriers that are created by this kind of lack of awareness, have to do mainly with communication, unequal treatment, discrimination, infantilization, and depersonalization. Again, misconceptions also around disability create significant challenges, as we saw in the testimonial before. And in terms of healthcare professionals, they just lack the knowledge about disabilities and they fail to adjust to communicate appropriately. I'll leave you with that quote. People with mental diseases are too often thought of as not knowing what is in their best interests. And again, this might have to do with misconceptions about mental health. It has to do with inability of communicating of the healthcare professionals, but it also has to do with informed consent, not recognizing that persons with disabilities should have legal capacity and make decisions for themselves. So, and I think with that, what we felt was to give you some time to reflect on these kind of points. And I'll give the floor to the panel. We have set up some questions, and we wanted to see also your feedback. First, we want to see what you thought of the barriers that are provided in this kind of mapping, and whether there are other important barriers that you want to provide. I don't know, Laura, do you want to begin?
No problem. First of all, I just want to say I'm really glad to be here in this conference as a member of the mental health professionals working day by day with people with intellectual disabilities. And second, I just want to apologize for my English. English is my third language, so well, I am going to do the best I can. Okay, Stelios, just to answer your question, I think in Spain, people with intellectual disabilities have to overcome the same challenges raised in the presentation. One of the difficulties they have is the access to the medical services. Secondly, the environments are not well adapted for their communicational needs. There is an important lack of training for the health professionals. And last is that the rights for the people with intellectual disabilities are not always being respected.
Thank you, Laura. Also, just not to be too biased against healthcare professionals. Also, my brother is a healthcare professional. So but we also spoke with them, and one of the biggest challenges is the shortages that lead to not just like long waiting times, but also they don't have enough time with patients. If they spend 10 minutes with each patient, then it's extremely difficult to find a way to communicate appropriately, get the consent, explain everything, and so it's also a structural issue and a failure of knowledge and training on the matter. Freddie, you want to pick up?
So, hello everyone, I'm Freddie, I'm advocacy lead at Inclusion Europe. So, let me first introduce the organization, so maybe you know a bit more the context. Inclusion Europe is an organization representing 20 million of people with intellectual disabilities and their families in Europe. So it's really good to be here today because we talked a lot about involvement today. So involvement in policy making, in the design of services. And so thank you to have us here to share views and perspective of people with intellectual disabilities and their families. And maybe one quick more context again. We worked a lot with an organization named the European Platform of Self-Advocates, and this is the organization of Sofiane, and I think he forgot to introduce this organization, so please feel free maybe to give this context as well.
Yes, so the European Platform of Self-Advocates is part of Inclusion Europe. In short, we call it EPSA. It is made up of people with intellectual disabilities who come from many different countries in Europe. The way EPSA works, it checks the work that Inclusion Europe is doing. EPSA is about making sure that people with intellectual disability have the right to make their own choice and talk to government. And every 2 years, EPSA has a conference which is called Hear Our Voices, and the last Hear Our Voices conference was in Estonia. At this meeting, the members of the European Platform of Self-Advocates speak about many different topics. They speak about the right to vote, the right to education, the right to housing, and yeah.
So thank you, Sofiane, for this introduction. But this was to say that access to healthcare was one of the topics that Inclusion Europe and EPSA covered during the past few years. So what we have been doing is we launched a report when we assess the rights and inclusion of people with intellectual disabilities in Europe. So as part of this report, access to healthcare is one of the indicators. We received responses for 31 countries and 400 people with intellectual disabilities. But now going maybe to the findings of the report, we found out that there are many discrimination in Europe when it comes to access to healthcare. I'm sorry, I'm going to disappoint you here because I'm going to echo what Stelios said before. So barriers related to affordability, to availability. But let me elaborate more on two barriers that Stelios mentioned in his presentation and that I want to stress here with you today. So the first barrier is on informed consent. So as Sofiane mentioned in history today, people with intellectual disabilities sometimes cannot make choices when it comes to their bodies, when it comes to their health. So, for example, in the example of Sofiane, the doctors ignored that he was there in the room and instead spoke with his support person. But just to let you know that in some countries, this is by law that people with intellectual disabilities cannot make their choices related to their choice. In these countries, people are deprived from their legal capacity and so cannot make their choices, and this is a guardian who is responsible to make the choices for them, and this has really bad consequences when it comes to health issues. For example, it can lead to forced treatment, to forced abortion, etc. And maybe I will surprise you there, but in the report that we made, we found out that in 27 countries, when it comes to legal capacity, people are deprived from their legal capacity. So this is the first thing. The second thing is that in Europe, many people live in institutions, so it's about 850 people with intellectual disabilities. 30,000 people live in psychiatric hospitals, and there, in this kind of settings, people are also deprived from their choice to make choices about their health as well. So I don't know if you are aware of, but last month the European Court of Human Rights condemned Hungary for a case regarding death of a woman in institutions, and one of the issues at stake was the inadequate healthcare that was provided in this kind of institutions. So first, I told you that I would like to elaborate more on two things. So informed consent was the first thing. The second thing is simply, but not that simply, is the accessibility part of it. So in the inclusion indicators report, we found out that only in 24 countries, information related to healthcare is made available in easy to read. And this is not an ideal context for people with intellectual disabilities to find information on healthcare, how to make an appointment, how to understand, as you mentioned, Stelios, the social security system, which is really complex in sometimes, and which with many barriers when it comes, for example, to ask for reimbursement, etc., etc. So in 24 countries in Europe, information is not made available in easy to read. And also something that was mentioned today, and I would like to insist, and because in the room there are many also professionals working on healthcare professionals, is the accessibility of communication between the doctors and patient. So in the report that the inclusion indicators report, we found out that around 31% of people with intellectual disabilities go to the doctor because they are hurt. This means one thing. It means that it's really important for professionals to interpret what being hurt is. And this is an issue of communication between the patient and the doctors. The doctors have to know how to have the information from the people and how to address it with, yeah. And so I'm really glad that the one point of this project is to work on this topic of communication, and I'm really happy to be here in the room to raise this issue again. So I was a bit brief here. If you have more questions about the inclusion indicators report, feel free to ask me on access to healthcare. And I give you back the floor, Stelios. Yeah.
Thank you, Freddie. And actually, the institutionalization was also something that we covered in the report, just for time reasons was not included in the presentation. I absolutely agree with you. Maybe we can give the opportunity to people in the floor or online to let us know if there is something that they want to bring to the floor regarding barriers in your own experience or challenges that you think it's important to mention that were not covered already.
Hello. Okay. My name is Giada Venier, and I am policy officer at Fondazione Dognocchi. It is the largest no-profit organization in Italy specialized in the field of rehabilitation. And we provide both medical and social rehabilitation to people with all kinds of disabilities, from childhood to elderly. So I work every day in close contact with the healthcare professionals. And I think that one element that maybe has not been raised in the discussion, maybe it's not a barrier, maybe it's a bit harsh, but definitely one factor that can make things more difficult, especially for informed consent and communication, is also the role of families and support persons, who sometimes they also don't know how to promote the autonomy of the people they care for. This can depend on national culture. Maybe in some countries in the south, you know, the welfare is family-centric, maybe due to the lack of adequate welfare services at national level. There is also a role of culture. So I come from Italy. In Italy, welfare, I mean, the family plays an important role for welfare, and especially when we talk about people with disabilities and intellectual disabilities. So sometimes the support persons are protective, maybe a bit too much, because they are afraid that if they give, I mean, if they are not there, they are not speaking on behalf of their child, maybe, then they are afraid to let them be by themselves. And this, of course, makes things more complicated for communication, because it's maybe sometimes it's not only the doctor who chooses automatically to speak to the guardian, but it's also the guardian who doesn't let the person with intellectual disability to speak. So I think there is the need to train, to raise awareness, not only among healthcare professionals, but also among the families, on how to, you know, to give them some tools on how to manage the situation, how to let the people with intellectual disability to speak. Maybe in some countries, as Freddie was saying, it is by law. So there the situation is more complex, and there is some policy work to be done. But in many other countries, I think that training, raising awareness, information campaigns could be useful tools to improve also on the family side. Thank you.
Thank you. Freddie, do you want to take on this? So
thank you for raising this point. yes, I completely agree with you. Family should play an important role here, and sometimes step a bit aside. And it's also a matter of culture. Yes, in Italy, family presence is much there. But as you mentioned, Stelios, in your PowerPoint, no, maybe it was the WHO video. They are working on, they are promoting an integrated services, but in the end, it's an integrated system. So healthcare professionals, family, and people with intellectual disabilities should work together in making yes, a personalized healthcare plan. So to be able to find ways on how families can intervene in the process when it comes or find point out when the professional is have the word to say and work together to find the better solution to promote the autonomy of the person, but also to promote his inclusion in the healthcare system. I don't know if I was clear there, but it's really we have to find a system to work together to address the personalized need of the person who is cared of. Yeah, and yeah.
Thanks, Freddie. Thank you also for your comment. I think there's also a big challenge in terms of accessing information for carers. So if a person is a carer, we have identified in our work that also they do not receive the necessary information to care for the people. So there is some tension there as well. But I agree with Freddie. The point is to integrate the healthcare service in a way that takes into account all these kind of stakeholders. Do we have someone else online or here? I cannot see. If not, we also wanted to provide some kind of context regarding, let's say, what is good, because it's a bit kind of depressing, the situation. I think it was appropriate also to say what positive things are happening, what good things are happening, and maybe, I don't know, Laura or Freddie, do you want to share some good practices?
Yes, in Spain, and I'm going to talk more specifically about Catalonia, because there is the place where I work, and therefore I know more. Since some years ago, the government creates a program who consists in a card named Cuidam card. Cuidam means treat me well. So the people with learning disabilities, intellectual disabilities, have this card, and having this card should guarantee for people with learning disabilities a more individualized healthcare according to their needs. The problem is this card is being processed since 12 years ago, but although people have processed it, many healthcare professionals still do not know what procedures must follow when a person is a card's beneficiary. Okay, there is one thing, and I think is the most general strategy that Catalan government tried to do. And other things that we, in a more specific, more local ways, we are trying to do, for example, is from the collective of entities of people with intellectual disabilities. In Catalonia is GINCAT, and with the support of our mental health service, we are trying to promote the use of the the health passports for people when they are assisted in a health service, and finally, just in a more local way, from our hospital, since 3 or 4 years ago, we have started to doing specific trainings with the medical services, with the gynecologist, the traumatologist, and just try to remember, the ophthalmologist, to train them specifically about the needs of the people with intellectual disabilities, and to help the professionals to adapt their work to the needs of the people with intellectual disabilities or autism spectrum disorders, just to make the job of the doctors or the assistants more easier for the patients and the health professionals. And this is a day-by-day job. It takes us a lot of days, a lot of months to do it, but it has started. But the problem is we need much more policies, much more strategies to make this better care to grow up. That's
Freddie?
Before mentioning something good, can I mention last thing, which I think maybe it's no, but maybe something that we didn't discuss today, and it's really important, is the barriers to access preventive healthcare. So, as Inclusion Europe made a study as well a couple of years ago in 2018, I think, and this study found out that people with intellectual disabilities are the most at risk of developing health issues like obesity, cardiac problems, etc., etc. And sometimes it's because they don't have the information on how to live a good life, a healthy life, I mean, having a good diet, doing sport, etc., etc. And as I mentioned earlier today, 31% only go to the doctor when they are hurt. So there are a significant part of them who don't go to the doctors, for example, for regular checkup, go to specialist, dentist, etc., just to see if things are good, and they just wait that things are bad to be able to go to the doctor. So access to preventive healthcare is also a big issue for people with intellectual disabilities. And this makes the transition to something that we find good as well. So on the Inclusion Europe website, maybe I can come close to you to showcase it. So just to explain a bit, if you go on our website, there is a small subcategory called healthcare, and you will be able to see on this web page toolkit that Inclusion Europe made for self-advocate and for professionals, with some tips on how to use an accessible language when it comes to access to healthcare. So, yeah, maybe.
Yeah, I guess that actually people at home are seeing it because it's shown on Zoom, but not. No, it's also here. Great.
This is the wrong website. So it's in live. Huh? If I do something wrong, this is. But I think it's much better if you see it with your own eyes, so maybe you can use it after. So here, healthcare. And here we have the toolkit in English. And this toolkit shows good practices on how to use accessible language when it comes to access to healthcare. So, for example, some advice on how to lead a healthy life, how to communicate with doctors, etc. The most important part of it, for me, are the good practices. So here you will be able to find some websites that are used in countries on accessible language used in healthcare systems. So this one is in France. This is a kind of easy to understand cartoon on different healthcare interventions, which is really illustrative. This card is really good. This is from Scotland, and this is a tip card to give to healthcare professionals on how to better communicate with people with intellectual disabilities. So I'm just going to read the points, for example, in this tip card, because I think it's really important in this discussion. So, for example, when a healthcare professional speaks to a person with intellectual disabilities, the points to consider are talking directly to the service user rather than the carer. So, as Sofiane mentioned today, explain what is going to happen. Avoid the use of jargon, use a plain language which is accessible. Check that you have understood what the person is saying to you and that they understand you, and make sure any further information is available in an appropriate format, and provide time and opportunities for questions. I think it's really important. These are simple advice. We are talking about a WHO framework, etc. today, laws, but it's really important to consider that really simple things can be done to improve access to healthcare, and this is one of the examples. So I invite you to have a look at this guide and see what is best for you, for your practice. Yeah. Thank you.
Thank you, Freddie, and Sofiane and Laura for your presentations. I guess things are not great, but there has been, I guess, significant progress comparing to where the situation were, let's say, before the adoption of the Convention on the Rights of Persons with Disabilities, that kind of raised awareness on disability policy and push governments to take action and push the European Union to take action. So there's a lot of things to do. There's a lot of good things happening on the ground, and it's very important that your project is taking into account that. And hopefully you'll promote it in a way that many people have access to the results of your study and your work, and it will benefit everyone. So thank you all. And I think there is a break.
Not almost there, not yet.
Oh, no?
Almost there. You have to, well, almost there. I promise, almost there. So thank you. Thanks, Stelios. Thanks, Laura. Thanks, Freddie, for your contribution. Thanks a lot. Yes, almost there to the coffee break. We have another very intense session actually now, because, well, we spoke about here and there about the Equal Treatment Project. This is part of what we want to showcase today. So I would like to welcome the coordinator of the Equal Treatment Project, first of all, my colleague Panita Bol, working with me at the European Platform for Rehabilitation. But we also have here other partners of the consortium. So I would like to welcome Anna Descalacchi for the Center for Biopolitics Research at Pantheon University. There you are, yes. Vasiliki Muka, you're online. You should be there online from Margarita, another partner from Greece. Ina Nieminen from Tampere University, Finland. And Vittoria Pishalkenie That's very difficult every time, but I tried it, right? From Kaunas Kolegija, so the University of Kaunas. We have a very packed half an hour. Did I mention everyone? Yes. We have a very packed half an hour, so I will be quite strict, maybe, with timing, so be prepared for that. But first thing, yes, I would like to give the floor to my colleague, Panita Bol. Here we are. I was looking for you. Okay.
Thank you, Roberto. Am I on?
Now you are.
Thank you. So my name is Panita Ball and I'm the Project and Events Officer at the European Platform for Rehabilitation. I am the coordinator of the Equal Treatment Project, which is Erasmus funded and aims to support the equal treatment of people with intellectual disabilities into secondary and tertiary healthcare services. Today, the project partners and myself are absolutely delighted to launch and to share with you the project results that we have been working with over the last 3 years. But before I do that, I would like to introduce to you the project consortium. There are 7 partners, including the European Platform for Rehabilitation, which is an umbrella organisation of service providers that support people with disabilities. Thank you. So if you can just go to the slide with the project partners. Thank you, Raya. We have 7 organisations that comprise the project consortium, and they are mainly institutions from the sectors of healthcare services, from research and innovation, and from academia, from further as well as higher education. We have Margarita Vocational Training Centre from Greece. We have the Foundation Institute of Biomedical Research from Spain. Rekabi, the Research Centre of Biopolitics at Pantheon University from Greece. Tampere University from Finland. Fondacio Campusano de Skela from Spain. And Kaunas Kolegija from Lithuania. The overarching aims and objectives of our project was to support more effective policies on inclusion in healthcare services for persons with intellectual disabilities, more effective training of healthcare staff to interact with our target population, lower barriers for our target population in accessing healthcare, and that includes physical as well as digital barriers, stronger and better collaboration between healthcare staff and other professional supporters. So I will now pass the floor to the project partners to present and launch our project results that include 10 policy recommendations that were developed based on the research findings that we undertook and found in the first phase of our project. And then we would like to launch our self-e-learning training programme, firstly for healthcare staff and healthcare students, and secondly for the professional supporters. So I would like to pass the floor now to Anna from the Research Centre of Biopolitics at Pantheon University to present the policy recommendations. Thank you, Anna.
Thank you, Panita, and thank you everyone for being here with us today as we unveil our project results. So I will go through our policy recommendations that we have developed in order to address the challenges that people with intellectual disabilities face when they try to seek hospital care. And yes, so this project began with clear purpose, we think, which was to uncover barriers people with intellectual disabilities face when seeking medical care, as well as to propose some practical solutions in order to make healthcare systems more inclusive. So for this reason, we relied on a robust methodology that combined several research activities that wanted to paint a full picture of the current situation, as well as to inform our recommendations. So first we conducted a literature review to understand the global and European policy framework, as well as to identify key challenges documented in studies. So this review highlighted some critical issues, such as communication barriers, insufficient training for staff, as well as systemic inequalities that disproportionately affect people with intellectual disabilities. Next, we launched the Good Practices collection, which involved gathering examples of successful strategies that are already in place in various countries. And this process focused on 4 key areas, including effective policies, reducing barriers to access, training healthcare staff, and fostering collaboration between healthcare staff and professional supporters of people with intellectual disabilities. Then the third pillar of our methodology was the stakeholders' needs analysis, which was perhaps one of the most enlightening aspects of the research, since it included healthcare staff, people with intellectual disabilities, and professional supporters. So we gathered over 400 participants, provided their insights into their experiences, needs, and challenges. So, for example, people with intellectual disabilities shared how overwhelming it can be for them to navigate into hospital settings, or professional supporters and healthcare staff highlighted the lack of training in communicating with this patient group. So, bringing all these findings together, we developed 3 conclusion reports that summarized our main findings, the main barriers and the opportunities, and then drafted our policy recommendations. And through this process, we consulted with the Policy Advisory Board of the project, which is composed of experts in healthcare and disability rights. And their guidance helped us to ensure that our recommendations were grounded in both practical experience and policy expertise. So this thorough approach allowed us to not only identify challenges, but also pinpoint actionable solutions, leading to the set of the 10 policy recommendations I will now present, many of which have been already addressed from previous speakers, actually. And we invite you to see them as not as some standalone ideas, but as a roadmap or a vision of a healthcare system that treats people with intellectual disabilities with the respect, care, and dignity that they deserve. So, first of all, let's start by addressing a core issue, which is discrimination in access to care. We found that clinical pathways often fail to account for the needs of people with intellectual disabilities and leave them with at greater risk of poorer health outcomes. So to address this, we recommend that hospitals adopt clear protocols that focus specifically on people with intellectual disabilities rather than relying on generalized disability policies. And by using existing examples of good practices like dedicated training workshops for staff, we can ensure that these protocols are not just words on a paper, but are brought to life in daily operations. So equally important, of course, is the need to disseminate these practices at the regional and local levels in order to ensure that to ensure the continuity of care and that people with intellectual disabilities receive services of the same high quality no matter where they access the healthcare system. So next, one more powerful tool to improve care is improving or introducing identification systems. So healthcare providers might benefit a lot through their initial contact with patients if they have a concise document, for instance, a health passport like the one in the picture here, that outlines patients' needs, preferred communication methods, health history, and other very important information. These kind of tools are already in place in countries such as Finland and the UK and ensure that patients receive appropriate accommodations right from their initial contact with their healthcare system. And speaking of accommodations, we should talk also about reasonable adjustments that are key to making healthcare systems truly accessible. For example, reducing waiting times or offering double appointments slots can alleviate anxiety and ensure thorough care. So, or another example is imagine a patient who struggles with overstimulation in overcrowded rooms. So a simple measure would be letting them just wait in a quieter space, which can make an immense difference in their overall experience. Yes. Also, communication, of course, as it's already mentioned, is another area where small changes can have a big impact. Many people with intellectual disabilities might benefit from visual aids or other assistive products in order to understand and go through medical procedures such as pictograms or easy-to-read materials. So, for instance, before a blood test, showing patients pictures of the procedure, what is going to happen, like this one here, that says that the nurse puts a band on my arm, might alleviate stress and ensure that cooperation is facilitated. And of course, we emphasize the importance of supported decision-making because, as previous speaker said, too often healthcare staff direct questions to patient supporters rather than the patients themselves. And of course, supporters are vital, but we must prioritize the autonomy of people with intellectual disabilities. So by taking a little extra time to engage directly with the patients, by asking them, listening to them, and of course respecting their choices, we can empower them in their healthcare journey. And of course, all these changes require training not only for healthcare providers, but also for people with intellectual disabilities and their supporters. So on the one hand, healthcare staff need to learn how to communicate effectively with people with intellectual disabilities, handle challenging situations, and provide person-centered care, which is what we try to do through our project, actually. And on the other hand, people with intellectual disabilities could benefit from training that helps them navigate better healthcare systems, such as booking appointments and going through hospital procedures. So this dual approach can help build confidence on both sides and have smoother interactions between staff and patients. Another idea we advocate for is appointing disability champions within healthcare settings. These professionals that are trained specifically in working with people with intellectual disabilities can act as bridges between healthcare staff, patients, and families and supporters. For instance, an intellectual disability nurse might help a family prepare their child before a surgery by explaining the process step by step and ensuring that the medical team is aware of their needs. And lastly, of course, we believe in the power of co-production. Healthcare services need to be designed with input from people with intellectual disabilities and their families and supporters, because who is better to identify gaps and suggest solutions than the people that are most affected by them. And all of this, of course, requires resources, so we need sustained funding at both the national and the EU levels to implement these recommendations, because change cannot happen overnight, but there needs consistent investment. So thank you for your attention, and I look forward to your questions and to further this discussion.
Okay, thanks. Thank you, Anna, for the very detailed overview of the policy recommendations. And now we have another colleague from Greece again, if you're there, Vasiliki Mouka from Margarita. I think I saw you there before, so I guess you are there now. Can you hear us?
Yes.
Otherwise, we will give the time to... Well... Yes, I guess I can see you. Here she is, so she needs to be spotlighted. Welcome, Vaya, or Vasiliki. Nice to have you here today, and thanks for... Oop, you're muted, or we don't hear you at least. Not yet. No, we still don't hear you. Maybe without your earphones, maybe if there is no noise in the room. Can I try and talk, maybe? No.
Can other partners...
Do we hear her? No. Okay. You're muted, yes. Maybe when while you try either to change the settings or change the earphones there, we will go to the next speaker, so we recover some time and give you time to have a look at the settings there. So if you agree, we could go, if it's okay with you, Lina, to show us the Moodle platform that we have developed, and then we will go back to Vasiliki to have a look at the content of the platform itself.
Can you hear me now?
Yes, I would say you can go, yes. Raya? I think, okay. Sorry.
Using the same computer.
Mm-mm.
Can you hear me now?
Mm-mm.
Okay, Vasiliki will soon...
Oh, great. So nice.
Okay. Okay, Vasiliki will soon share with you what the content that we have created to our online course, and I'm going to show you how you can have an access to that course and how you can see the material that we have created. If you are here present, you can use the QR code and log in as a guest. Or if you are in the website, if you're in online, let me see if I can give you the link somehow. So this is the web page where you will see at first, and you can access as a guest if you're here, and that way you will be able to see our English version of this equal treatment online course for healthcare professionals. And I'll copy the address to the, let me see. Yeah, to everyone so that everybody can come there. Okay? So here, as you can see, we have created 3 modules for healthcare professionals to study. First of them is about understanding the intellectual disabilities, so what they are. Then we have material about the good communication and communication barriers, and also there are the basic principles of supported decision making. And then the 3rd module is about good practices and services in healthcare. And now, if you have access, if you have come to the online course as a guest, you will be able to go through the material as it is. There are different kind of content. There are books that have the theory part. Then there are some cases, examples about different kind of situations. And then at the end of each module, there is a multiple choice self-test. This is something that is not available if you are attending to the course as a guest, but this is for the people who wants to come here as a student, and you have to then create an account to DigiCampus in order to participate to the online course as a student, and that gives you access also to the certificate of this course after you have passed all the tests that there are. And this equal treatment course, we have this main bigger course for the healthcare professionals, but we also have a course for the professional supporters. And both of these courses are available in 6 different languages. So, let me see. So there is in addition to the English versions of these courses, we have a Greek version, Finnish version, Lithuanian version, Catalan version, and Spanish version. And you can find those by using the search bar in DigiCampus. And if you put equal treatment, these 2 words there, you can find the different language versions of this online course.
Great, thanks, Nina, for showing us the platform. Of course, well, the invitation is to try it, right? Discover it a little bit. So we're going to share with you the link, of course, to the platform. So the best thing would be to go online and, of course, browse through it. You will find all the resources that we developed through the project. Now we go back to Vasiliki. Actually, I think that it was our fault because I see that in the comments on Zoom, the others on Zoom can hear you. So it's actually us here that can't hear you. We give it another try. Otherwise, we go to the next speaker and we maybe wait for after the coffee break. So we solve the issue with you, Vasiliki, and we will well have you in a few minutes after the coffee break. Maybe. Can we test it? Yeah. Let's try now.
Can you hear me?
Now it works. That's great. Yeah.
Okay, I'm glad. I'm very glad. So, good morning again from Athens. I'm very glad to be here even by internet. And I just, in a bit of spoiler about the material, about educational modules, but it's okay. I just want to explain the rationale behind developing the educational material. So please, can the slide show up? So my name again is Vasiliki Mouka. I am the psychiatrist in Margarita Vocational Training Center in Athens, Greece. And please, can we go to the next slide? So, about the development of the educational material of equal treatment, it is, as it is here in red letters, included in the work package 3 and the work package 4. And this means that we first had our stakeholders' needs analysis after giving them a questionnaire and wanting to know about their needs and their preferences. It is after we had our literature review, it's after we had our collection of good practices, and then we gathered all this knowledge and information and tried to define the best way to have our educational material developed. Can we have the next slide, please? So, the pillars for the development of the educational material are actually 4. First, the aim of the Equal Treatment Project, what do we want to do? Secondly, the collection of good practices. Thirdly, the literature review, and then the needs analysis. In specific, can we go to the next slide, please? We had in mind what our learners wanted to know more about intellectual disabilities, and what they ask for us, from us, to give them in terms of knowledge. We had specific learning objectives, and we always search for more educational material from literature review, and the one was affecting the other all the time. Can we go to the next slide, please? So, first of all, the aim and the objective of the Equal Treatment Project is to improve the access of people with intellectual disabilities to secondary and tertiary healthcare through inclusive European policies in healthcare services, training of healthcare staff on interacting with patients with intellectual disabilities, and stronger collaboration between healthcare staff and professional supporters. As stressed here, the words access, training, interacting, and stronger collaboration. And the final objective is support the rights and access and better healthcare of persons with intellectual disabilities to secondary and tertiary healthcare services. Can we go to the next slide, please? Now, about the collection of good practices, we had useful material of what good practices already exist. What ways these good practices can be effectively disseminated among healthcare systems and healthcare professionals. And the collection of good practices show us the importance of effective training on treating persons with intellectual disabilities and what these training programs that already existed included. Can we go to the next? Thank you. And regarding literature review, it was a useful collection of valuable material from scientific articles on every aspect of treating persons with intellectual disabilities. I will explain this later. Needs analysis. Now, needs analysis helped us to define the request of the healthcare professionals and professional supporters, what, in other words, they needed to know, what fields of knowledge needed to improve their insight and understanding, and how they preferred these materials to be presented to them. For example, they liked the answer that they liked to educational materials to have videos. With needs analysis, we knew and we needed to include the persons with intellectual disabilities' own opinions and preferences of accessible and inclusive secondary and tertiary healthcare services. Next slide, please. And before some points that we took into consideration before developing and while developing the educational material is that our participants, our learners, may have very different levels of knowledge and experience with persons with intellectual disabilities. For example, persons at the administrative hospital staff, they have degrees that they had nothing to do with intellectual disabilities or some knowledge on intellectual disabilities. We took into consideration about the concurrence of intellectual disabilities with other developmental disorders and the need that we would present these developmental disorders was obvious. Something that struck us, it was the very higher levels of comorbidity with physical and mental health disorders regarding intellectual disabilities and the one plus need to present them to our learners. And a wide range of barriers in effective communications with persons with intellectual disability, barriers not coming from the person themselves, not coming from healthcare professionals, but also some situational situational factors, for example, noisy environments in a hospital. Next slide, please.
Vasiliki, sorry to jump in, just to remind you, we have another like 3-4 minutes, so
okay,
I know that.
will be very fast. So,
thank you.
This slide, in this way, we developed 3 modules and 1 fourth module for a professional supporter. Next slide, please. So the educational material for healthcare professional is divided and presented in 3 successive modules. Average time for completion 6 hours for each module, depending on the level of established knowledge on intellectual disabilities. Material is presented in text, slide presentation, web pages and URL links, as well as in key presentations and videos as our stakeholders requested. And in modules 2 and 3 is materials enriched with interactive case presentations as our stakeholders also requested. Next slide, please. The material is somehow repeated in the same modules and throughout the different modules in the more user-friendly way, slide presentations, or for example, in module 1, there are very slim, there is a slide presentation called a brief summary, which is very introductive for someone to learn that has no experience with intellectual disabilities. There is an introduction section at the beginning of each module with instructions. At the end of each module, there is a multiple choice self-test and a feedback questionnaires, and of course, we have a certificate. Next slide, please. Module 1 is about general knowledge on intellectual disabilities, what it is, how it's defined, and their support needs, their comorbidity with other physical and mental health problems, and the concurrence with other developmental disorders. And some notes on the United Nations European Union legislation. Next slide, please. Module 2 is about communication and barriers in communication in general, and we needed to say all these things that have nothing to do with healthcare settings or healthcare services, because we wanted our learners to introduce our learners to the way persons with intellectual disability communicate and what tools we have in our hands and how they can learn more about these tools. For example, augmentative and alternative and augmentative communication tools. And we talk about anxiety, we talk about sensory processing distractions and behavioral problems that interfere with our efforts to communicate with persons with intellectual disabilities, and basic principles of supported decision making. Next slide, please. And in module 3, in 2 sentences, it's all gathered knowledge from the previous modules, plus our findings from the literature review and collection of good practices focused in the context of secondary and tertiary healthcare services. And we have some interactive case presentation in this module. Module 3 is about healthcare settings. And about its main topics and objectives, as I said, establishing effective communication with persons with intellectual disability and coping with anxiety, behavioral problems, and sensory processing dysfunction in the context of secondary and tertiary healthcare services. Good practices, ways, and regional adjustments, as Anna said, national laws on persons with intellectual disabilities rights, free and informed consent, and about module 4 about facilitator pathway. Next slide, please. It's all about supporting persons with intellectual disabilities and promoting their rights in the context of secondary and tertiary healthcare services. The most here in this module, are gathered the most important points of the gathered educational material of the other 3 modules, tailored for the needs of a professional supporter, knowledge, insight in some things, in order to promote effective communication, accessibility, proper quality of healthcare, and the rights of persons with intellectual disability in the context of secondary and tertiary healthcare services. Next. Now, throughout the 3 modules and the facilitator pathway, it's always present in our material the importance of promoting the rights. The importance of promoting collaboration with family, with other healthcare professionals and professional supporters, and the special needs of persons with concurrent autism spectrum disorder and ADHD. Thank you for your attention.
Thanks a lot, Vasiliki. Also, thank you for bearing with my pressure on you to squeeze things into a short, in a way, presentation. That also reflects the massive work that actually was done to try to identify the needs, identify the content, and put it together into 3-4 modules. That's been, I mean, it seems like 15 minutes of presentation, but it's actually been 3 years of work, so it's a lot. Thanks a lot, Vasiliki. Here we're talking about, of course, of competencies for healthcare professionals. Well, of course, competencies need to be assessed and evaluated. This is quite important, of course. So, Victoria, I'll leave it to you to explain it to us a little bit.
Thank you, Roberta. First of all, we would like to say a big thanks for the possibility to participate with the partners in a great project. Thank you for coordinators. And let me introduce the story of success about the competences, how they increased. And could you help me to show my presentation, Raya? And yeah, second one. The project aim has the results, achievements to increase the competencies, digital and professional competencies, no less in 20%. And very interesting to know how we succeed. Let me introduce. No discussion why the digital competencies are very important today in our society, but especially they are mostly important for the healthcare specialist staff because reduce paperwork, streamlines operations, improves diagnosis, accuracy, treatment plans, enables remote consultations and continuous monitoring. And we made a research. Thank you for all partners. The participants, students, and staff were from each partners. And we have, in total, 71 participants who completed a test. The test for assessment of the digital competences. And there were 5 key areas: information and data literacy, communication, digital content, safety, and problem solving. And very, very shortly, the results. And you see that in 58% increased these competencies, slightly increased or very increased. It's good results. And you see the means with the standard deviation before the training, online training, and after the online training. Let's go to the professional competencies. Professional competencies, very important for the healthcare specialists, for the staff. Why? Because the research shows that majority of Europe countries' nurses working with the patients with intellectual disability, educational still is lack. And healthcare professionals' attitudes and stigmatization can result in poor health outcomes. And we assess the competencies before and after online training in 3 areas. Knowledge about the possible characteristics and needs of patients with intellectual disabilities, communication, and managing their diversity. We use 10 questions for each module, for each competencies, and we involved 120 healthcare students and 157 healthcare professionals working in the secondary or tertiary healthcare services. The results too. Students increase competencies regarding knowledge about characteristics and needs from 10 to 37%, and staff from 6 to 34%. The competence number 2, communication with the people who have intellectual disability, a little bit less, from 1.7 to 17.2, and staff from 2.7 to 22.9. And competences related with the knowledges about diversity management from students from 8 to 26, and staff from 12.8 to 44. Do you remember that our target was no less 20, and you see 44, and it is the statistical significant. We used parametrical test, ANOVA, student test, and etc. And more details, no worries, I am not going to stay here, stop, just to see in bold with the statistical significant differences how these competencies increased during this online training, and the answers from the students and healthcare professionals. And conclusions, approximately half of the participants reported an increase in their IT knowledge following the completion of the module, and healthcare students and healthcare professionals increased the professional competencies related with the basic characteristic with the intellectual disability, communication, and diversity management. And the future directions, we can discuss more and more that lifelong learning, online training for healthcare professionals, introduced online courses for healthcare students, compulsory or elective in higher education. And thank you very much for your attention.
Thanks a lot also for being very concise, but clarifying the message. The message was that it worked. I mean, the trainings that were developed, you were telling us, are actually good quality, and they actually have an impact on the people that are actually attending to this training and having these trainings online. So this is the main thing. And thanks all. I mean, you've been doing it in a very scientific, of course, way. So that's very good. Thanks a lot for that. Okay, so thanks to the Equal Treatment Partners. Now we actually have a break, as promised. Maybe instead of half an hour, we'll do for 20, 25, 20?
20.
20. So they are telling me 20. So we're going to be back at 15 past the hour, and we're going to have a last session with testimonials. So that's going to be well, intense in a way, but differently intense. Okay. So see you in 20 minutes. Just a reminder for you: there is a registration desk outside. So if you haven't signed, please do that. And also there is the evaluation form. Well, you will do that later, but there is a QR code that you can scan at the entrance. So see you in 20 minutes.
Buen día. Espera acá. Ara, soc l'Helena i sóc una...
Welcome back, everyone. I invite you to take a seat. You'll have the chance to chat again later in half an hour when we close the meeting. Thanks for being back, also for those of you that are online. So as mentioned before, we are going to have now a session dedicated to some testimonials. Different, well, belonging to different groups, let's say. But first of all, I would like to welcome the moderator for the next session, Luis Marroyo, the CEO of Fundación Campos Bernardo de Escala, one of the partners of the Equal Treatment Consortium. Hello, Luis.
Hello, good morning.
Yes, now we see you, we don't hear you. I think I've been here before.
It should be now.
Now we should be. Try again.
Okay.
Now we do hear you. Great.
Okay, perfect. So, okay, I hope you had a fruitful coffee break and working. And now I'm pleased to introduce this part of the conference, which is consistent several contributions from the different stakeholders in this project, from professionals, from the health professional, as supporters, and also from persons with intellectual disabilities or other barriers in the interaction with the health systems. So I'm here with also with Miguel Fernandez from Campus Bernardo de Escala, and he's going to introduce some videos and show some short interviews, some register and some in live interviews. So let's go ahead with the first one, please, Miguel.
Hey, hello, good afternoon, everyone. It's great to see you, although from the distance. So the first video was provided by Idipsi and Laura.
Sorry, just a second again. Sorry to jump on you. I guess there are people asking you to, asking to raise the volume, which is not sure. It's okay. So we can hear you better. Try now.
Can you hear me? Can you hear me?
We do. Well, Luis, you're too close on the same city. This is why you can hear Miguel. But for us, it's still a little bit. Maybe Miguel, we just ask you to raise your voice a little bit, because I think that we are at the highest level we can have in the room for the volume, but still. Oh, great! That's also a solution. People can use their earphones as well. So.
Okay, let's try now. Okay, the first video we are going to show was provided by Idipsi and Laura, and it's about Elena. Elena is a healthcare user from Catalonia, Spain, and she's a 31-year-old woman with autism spectrum disorder. Her condition was difficult to diagnose, and before reaching the mental health service, where she is currently being attended, she needed to go to different professionals and receive wrong diagnosis, such as personality disorder. She is a good example of a person who has experienced barriers getting a correct diagnosis of what was happening to her. So go ahead with the video, please.
Hola, bon dia. Espera que... Ara. Soc l'Helena i sóc una persona amb neurodivers... Bueno, que tinc una afectació cognitiva i unes... Bueno, així mental. Perquè si no, no ho sé dir. Neurodiversa, això me deien. Fa un temps que estava passant en un episodi de depressió molt greu, vale? I em vaig veure amb la necessitat d'anar a urgències perquè els tràmits i així ens anaven molt lents. I des d'allà em van derivar cap aquí. I total, que va ser una decisió que vaig prendre molt bona, en opinió meva, perquè vaig trobar les persones que m'entenien superbé i que em respectaven i escoltaven el que jo tenia per explicar-los i per dir-los. Al principi no ho relacionava gaire amb les tomes de medicació, perquè no ho veia com que una necessitat que jo tingués en aquells moments, perquè tampoc era conscient que jo estigués així malament. Però vosaltres vau treballar amb molta cura i revisant els meus diagnòstics, explicant-me les opcions i ajudant-me a entendre que necessitava alguns suports perquè jo pogués estar millor. El vostre tracte respectuós i la vostra comprensió sempre han estat molt importants per mi i per al meu procés per millorar. Per això voldria demanar a tots els professionals que treballeu amb persones neurodiverses que us dediqueu temps a informar-vos i a formar-se per com entendre'ns a nosaltres més bé. I la diferència és molt gran. I ja està, doncs moltes gràcies a tots i us animo molt.
Okay, thank you. So our second video was provided by our partners from Kaunas University, and it's about Iveta. Iveta is a nurse.
Hello everyone, organizers of the conference.
She participated in the online courses prepared by Equal Treatment Project together with her colleagues. She was pleased that she was able to learn in detail about the peculiarities of communication and information comprehension of people with intellectual disabilities. Iveta was pleased that the training was online and she could study at a time convenient for her. She must provide services to patients with intellectual disabilities, and distance learning was a great opportunity, not only to update her knowledge, but also to learn a lot of new things. So please go ahead with the video.
Hello everyone, organizers of the conference, participants of the project, teachers, coordinators, and the rest. I'm from Lithuania, and I would like to thank you on behalf of my colleagues and myself for the opportunity to participate in this equal treatment remote training about intellectual disability in persons and the specifics of healthcare services provided to them. So we are also grateful for this educational project, which has helped to better understand how to provide appropriate and sensitive secondary and tertiary care for this population. During these trainings, we learned about specific signs of intellectual disability and their impact on their everyday life. And also as well how to properly recognize and assess the needs of people with different levels of intellectual disability, which is really important. We delved into principles and strategies of communication that allow you to build a relationship based on trust and help overcome communication barriers, and especially important when dealing with the patients who have difficulty expressing their conditions or feelings. The knowledge and practical advice which was gained during this training actually broadened my understanding of challenges posed by intellectual disabilities, and the special needs are necessary to provide the quality support. And I'm convinced that this knowledge will allow us to respond better to the needs of patients and ensure that everyone receives the best possible conditions and care in healthcare institutions. So once again, on behalf of our institution, I would like to express our gratitude to the organizers of the project who shared their knowledge, experience, and gave advices while preparing the material for this module, and also for the professionally prepared training program and the possibility of distance learning, which was really important for us because it was really flexible and we could discuss with our colleagues So it made this learning process much easier, and it actually was accessible to many specialists. So I believe that together we will make an important difference in improving healthcare for people with intellectual disabilities. So thank you once again.
Thank you. So far, we have had perspective from healthcare user and then healthcare professional. So now's the time to have another perspective, which is from a health manager. And now we are going to show you a short interview that we did to Mr. Claudi Camps. Claudi Camps is the managing director of mental health services and addictions in Girona, Spain. He has been promoting and implementing the process of deinstitutionalization and the transformation of services through a community approach. For these reasons, the region of Girona has become a reference in Spain and beyond for guaranteeing the rights of people with disabilities in their interaction with health structures and systems. Mr. Claudi knows the Equal Treatment Project and its results, and he is here to talk about it from a strategic point of view. So go ahead with the interview, please.
Please, could you explain why you consider the equal Please, could you explain why you consider the Equal Treatment Project training to be important for health professionals?
Yeah, currently the risk of dying for persons, for people with intellectual disabilities is 4 times greater than the general population because they have not received the health care that they need. Consequently, we need to improve the relation with these people, as well as the collaboration the health professionals to ensure an equitable and respectful care.
Would you please give your opinion on the suitability and feasibility of including such training in the university curricula of healthcare degrees?
Yeah, we must take in mind that we are talking about a significant percentage of population. And I think it's easy and essential to include this training in university curricula of health degrees. And thanks to initiatives like yours, we already have developed methodology.
Thank you. Okay, now's the time for a short interview. We are going to talk a little bit with Miss Effie Lucky, who is sitting next to our project colleague Evangelia from Athens in Margarita. So we have prepared a few questions for her, and she will answer for us. So a brief introduction. Miss Effie is an occupational therapist at Margarita, and she has reviewed the content of the Equal Treatment course for professional supporters. And now we have the opportunity to ask her a few questions. So good afternoon, Effie.
Hello, nice to meet you. Hi.
Hello. So first question is, how useful are the results of Equal Treatment Project for your professional daily practice?
Okay, actually, I think it is very useful because they're bridging the gap between the health professionals and the specific needs of autistic individuals or individuals with intellectual disabilities. As I saw the courses, they provide valuable insight about how hospitals and healthcare professionals can adapt their practices, I think, to accommodate those specific needs of that population. And actually, I think it's really important, because I had a personal experience 2 years ago regarding that topic. Because an autistic boy who worked with me in occupational therapy program had to be hospitalized. And I remember that it was really difficult for me to communicate with his doctor, for me and for his parents, and to explain the rationale behind some autistic behavior. For example, that boy was overstimulated with bright lights. So I had to explain, and I remember very clearly that it was really hard for me to explain that we have to move that boy to another room without light, for example. So yes, it's really useful.
Thank you very much. So for you as a professional, do you have now more confidence after the training to support a person with intellectual disability to visit hospital?
Yes, of course. I have already confidence due to my background as occupational therapist, because I know the needs of those people, but I feel really confident because I know that maybe we have a common language with doctors or medical staff, because in several times we have to collaborate with them. So I feel confident if I know that we have a common language regarding that. And also, I'm feeling good to know that hospitals make steps for inclusivity of for those people, because it's their right to. They have the same right about the provide of health care services.
Great. Thank you very much, Effie, for your time.
Thank you.
For being here.
Thank you for that project.
And for your feedback. Well, over to you, Luis, if you have anything else to add, so please go ahead.
Well, just to say that from the testimonial, having clear that we need first tools, and second strategies to I think to improve the interaction of people with disability, with intellectual disabilities, with the health system in general, not only secondary and tertiary, but also primary care health systems. So also from the academic point of view, I think have been clear for the testimonial of the chief of the mental health and addictions service in Girona that the curriculum should be improved, because many students, for example, that interact with us, with Campus Arnaldo Scala, to do a practical stage, they have no idea of what does right means, what guaranteeing right means, for example. So there is also a need to improve the curriculum, and of course, from the testimonial of Helena, the service user, she's asking us to improve in our practice. So I think it's okay, round point of view of about all the issues we are dealing with. So I think it's we can continue talking in the next slots in this next conference. talking about the future, and may you, Roberto, you can introduce this part. Thank you.
Thanks a lot, Luis. Thanks, Miguel, and thanks to Ellen as well, and also to the people that were interviewed and that shared with us their videos. We are almost at the end of the conference, so we shared already a lot of content, and we showcased, well, a little bit the problem, why we decided to focus on this topic, what we developed in terms of project to tackle the problem. But of course we know that, well, we wouldn't be here if we already solved the problem through this project. So we are very well aware that we need to probably think of further steps together in a way, in terms of having a broader and more significant impact. Of course, part of it is this event and exploiting as much as possible the results of the Equal Treatment Project and the training courses, the good practice guidelines, etc. So to use them as much as possible. So that's of course an invitation to you all. Try the platform, test the tools. Well, they have been tested, so they should be properly working, but use them, and of course come back to us if you have any question. We will share with you the presentation, so you will have also our contacts as usual. But the invitation is really make the best use possible of what has been delivered so far. At the same time, well, we're saying, well, this is not enough, of course, so we are thinking of what potential next steps could be in terms of, well, project, in terms of efforts, in terms of collaborations. This is going to be an open discussion, actually. I'm just going to, summarize the inputs that we received from you all today and throughout the project, actually. Before we said, well, of course, we're focusing in this case, and that's something that also Luis was saying now, we're focusing on secondary and tertiary healthcare services. This is a very specific type of services, of course. But of course, we understand that the same problem in a way in terms of communication, in terms of awareness, in terms of knowledge, cultural shift needed would be also applicable to primary care, probably, right? So we are thinking, okay, maybe we could focus on primary care, and of course we want your feedback on that. I'm going to ask you to give us feedback on the potential ideas. But also we said, well, we focused in this project on doctors, nurses, and frontline staff of secondary and tertiary healthcare services. We also provided training to, we call them professional supporters, because every country has different names, some like social workers, let's say, or social workers working with people with intellectual disabilities. But you were mentioning today, of course, the key role of the support persons. So they could be families, it could be, I don't know, friends, close ones. We didn't work that much, we didn't focus that much on them on this project, but actually it's like one piece of the puzzle that is actually missing if we don't focus on them as well. Well, if we want to change the framework a little bit, they have a key role there, so if we don't work with them, well, we will not reach the impact that we want to reach. So this is potentially another way of development. But also we were saying, maybe Freddy, was you were talking about preventive healthcare, right? So yes, so of course we're talking about cure, the healthcare system in terms of I have a disease and I need to be cured, let's put it like that, or healed. But this is not what health is all about. Health is healthy lifestyle, healthy aging, it's about knowing about how to stay healthy. And of course we were not particularly focusing on that in this case, so we're not providing training on how to keep healthy for people with intellectual disabilities, for example. So we weren't focusing much on that, but that could be a very interesting development, I think, after this project. On also, well, that was mentioned in one of the interviews, the need to improve and to improve, I would say, curricula, to again work on professionals, but in a more structured way. So not just providing a few trainings, but trying to push a little bit more to the change of the proper curricula. Even though, of course, that's another level in a way. So yes, these are the inputs in a way that we are thinking of. We're also going to have a meeting today with the project partners that are here to think of the possible next steps. But I would really very much like to know your perspective on that. So what do you think we should go on doing or do better for the next round, or what do you think could be relevant but we didn't touch with this project? So what is your input on that? What are the stakeholders that maybe we didn't involve? What are the topics that we didn't?
So, yes, just one suggestion and maybe one thing that we didn't touch upon today. So we talked about strong tools, strategies, etc. But we need also better laws about that. Let me elaborate a bit. We had a discussion last time with Stelios. He's not there in the room, but only half of the European countries have a law which prohibit discriminations in access to health. And this is not acceptable when discrimination is not on access to health. It's not explicitly prohibited by the laws. And this have many impact in terms of, for example, obligation of providing reasonable accommodations. And this can be, for example, supported decision-making systems. Countries that are obliged to have support persons there to help people with intellectual disabilities to access doctors, to have accessible information in easy to read on the I don't know, social security system, etc., etc. And there is a directive in the pipeline at the EU level. So this is the anti-discrimination directive, the horizontal one. And this is blocked by the EU Council. And yes, so maybe this is one of the discussion that we can have. Maybe you can highlight this also in your study, how laws can improve the situation regarding all of this and what is needed. Yeah. So this one, this was one suggestion. Maybe it's a big one, but I'm playing my role of advocate for people with intellectual disabilities there. So yeah, so thank you.
Thanks, Freddie. Yes, I do agree. It's a big one, but still, I mean, small steps in that direction. Yes, I totally agree with you. Yeah. Anybody else that has any thought? I know you're very tired, of course. It's been 3 hours, but still. Chada?
I was mentioning it during the coffee break, talking to with Panita. Maybe one idea could be to continue to work on the training modules and tailor them to treating persons of intellectual disabilities of different age groups. Because I was thinking, for example, in Doniochi Foundation, we have a child neuropsychiatry unit. So we also treat little ones, children or very young teenagers with a wide range of disabilities, including intellectual disabilities. And so before I was thinking to myself, maybe the way you communicate to a young child with intellectual disabilities is slightly different compared to how you communicate to an adult or how you deal with an elderly patient. So maybe instead I am wrong, and there are the same tools, the same techniques or strategies, let's say, for regardless of the age of the patients. Maybe that could be a research question for a second version, let's say, of the project, and maybe that could lead to some tailored, specialized training modules. An idea.
Thanks, Charlie. It's a good point, actually. We didn't think about it at all with this project, but I think it could be relevant. But actually, I'm also going to ask you, Sofian, what do you think in terms of, for example, this perspective of, focusing on different ages with different tools? What is your perspective? And in general, what do you think would be a good thing to do now for us?
Well, I would say to involve more people in, like doctors, give them trainings on how to deal with a person with a disability, someone who's deaf, someone who's blind, someone who needs a special system to read, like a screen reader, and have like a booklet where the person can go with his hand. I feel bad in my arm and in my stomach, and I agree with that there should be a system also for, you got people who have dementia, Parkinson's. There should be a system that's simple and easy to understand, so doctors can get to the point and help everybody.
Yeah, thanks for the inputs. Yeah, all good inputs. We will need to, we're going to have a long afternoon ahead of us to discuss them. Thank you. Anyone else? Okay. So I would like to close the meeting now. Thanks to all of you for being here, of course. Our Secretary General, Alicia Gomez Campos, couldn't be here with us today, so I'm bringing her greetings to you, of course. I would like to thank, first of all, Raya Mihailova and Benedetta Pesce, my colleagues of the EPR, for being the backbone of the event today and making things happen. Of course, Panita Bol, the coordinator of the Equal Treatment Project and one of the main organizers, or the main organizer of this event. The project partners, here in the room and around Europe, of course. All the speakers, I will not name you all, but thanks a lot for your contribution. And we really hope that this is not going to be the last time we develop something that can help tackle the problem that we were working on and discussing today. Just last reminder, evaluation form, please remember that we need that. And if you haven't signed, please sign the registration form, the student list outside. Thank you, and it's been a pleasure to have you all here.